Delegates, ladies and gentlemen, I join the World Health Assembly in extending my heartfelt thanks to the Honorable Minister of the Republic of Guatemala, Dr. Edwin Ducolotti, for his remarkable stewardship of the 77th World Health Assembly, and to Dr. Yongmi Ji of the Republic of Korea for guiding this morning's opening session. On behalf of the Philippines, it is my deep humility and great hope that I accept the honor of presiding over the August Assembly as the 78th World Health Assembly President. To the member states of the Western Pacific region and to all WHO member states, I offer my sincere gratitude for your trust and confidence. You have not only entrusted the Philippines, but more importantly, reaffirmed our shared commitment to global solidarity in health. I also salute the leadership of Dr. Tedros Adhanom Ghebreyesus, whose unwavering vision has breathed life into a new era of multilateralism, one that is bold, inclusive, and deeply rooted in the principle that no nation can stand alone against the tides of disease, disaster, and disparity. We live at a time of deep uncertainty, where fear and despair cast long shadows. Yet through the storms, the WHO has stood as a refuge, a sanctuary for health and peace. Born from the ashes of World War II, it has become a sacred gathering ground where nations, once divided, united in purpose to protect, to uphold, and build peace through health. My hope is that this remains true, for the world without WHO is a world without hope. Excellencies and distinguished delegates, today we gather not merely as representatives of our sovereign nations, but as custodians of humanity's shared future. In this assembly, history pauses to mark a defining moment for the world. The WHO, one shaped by the crucible of a pandemic that laid bare both our vulnerabilities and our capacity for collective resilience, including our own limitations in battling diseases, poverty, conflicts, and environmental destruction. We, as a human family, have seen in the depths of suffering, but we have also glimpsed the light of hope, a hope kindled by equity, fueled by cooperation, and sustained by the belief that unity, not division, shall prevail. The pandemic agreement stands as a testament to this unity, a product not of imposition, but of painstaking dialogue across differences. Indeed, a signal of hope in the divided world. For over 3 years, our delegation sat side by side, not to dominate, but to deliberate, not to divide, but to dream of a better, fairer world. Within its provisions lies a promise: access for all to vaccines, diagnostics and therapeutics, and other pandemic health products, sustained investment in our health workforce, equitable sharing of knowledge, and innovation through research and development, and groundbreaking mechanisms for shared responsibility, such as the pathogen access and benefit sharing system, and the coordinating financial mechanism for the implementation of this global accord for pandemic prevention, preparedness, and response. Let us be reminded that this agreement affirms our national sovereignty and the abiding commitment of countries to contribute to global consensus building in preventing the spread of disease and its consequences, and loss of lives and livelihood. Our sovereignty is not diminished by cooperation. It is elevated by our willingness to contribute to the common good. The pandemic has imparted profound lessons, insights that will shape the way we navigate this new world, unfolding before us. Yet, amidst the winds of change, some challenges persist with unwavering tenacity. Tuberculosis continues to burden communities, with an estimated 11 million people affected worldwide. HIV remains a formidable threat, particularly among marginalized and key populations, with nearly 40 million individuals living with the virus. Mental health quietly endures in the periphery, as one in 8 people grapple with mental health conditions. The scourge of tobacco remains one of the most persistent and preventable threats to global health, silently undermining progress across generations and contributing to the vast majority of non-communicable diseases that now account for most deaths worldwide. These are not mere numbers. There are names, faces, and stories. As a global community and as champions of health, we are called to urgently act, not simply with sympathy, but with boldness and resolve to address these long-standing health challenges. The new world does not require us to recover, but also to transform. Innovation is the heartbeat of progress, but it must be tempered by compassion, with equity as a core principle. Let us harness new technologies not as instruments of profit, but as tools of service. Our patients, our people, must be empowered not as passive recipients of care, but as partners in disease prevention, guardians of health, and voices of accountability. Let multilateral discourse be inclusive, lifting up the unheard voices of the suffering and the silenced, stigma, poverty, gender inequality, and marginalization are injustices we are duty-bound to dismantle. We must continue to build strong institutions and sound governance structures, for they are the foundations of effective decision-making, promote accountability, and foster transparency, paving the way for fairer, more inclusive policies and services. Indeed, people-centered health governance anchored on universal health coverage, focusing on transformative primary health care, is a barometer of our collective commitment to human rights. Through the United Nations High-Level Political Declaration on Universal Health Coverage, we renewed our shared promise that health should never come at the cost of dignity or financial ruin. We pledge to align our investments with primary health care, to strengthen subnational and local systems, and to confront the root causes of illness and reinforce interventions addressing social determinants of health. Since 2013, the Philippines has made meaningful progress in the implementation of the universal health coverage, including the implementation of health taxes on tobacco, alcohol, and sugar-sweetened products. Yet, numbers still speak with painful clarity. 2 billion lives burdened by out-of-pocket spending for health, and over 500 million still waiting for essential care, affordable medicines, and technologies they deserve. With only 5 years to 2030, the gap between our vision embodied in the Sustainable Development Goals and our progress remains wide. We must quicken our pace, fueled by the truth that every life saved, every illness prevented is a triumph of humanity. Our work must transcend ministries and borders, advancing not just health, but finding commonality in education, food security, environmental justice, gender equality, digitalization, and advancements in technology. Let us not lose sight of our purpose. We, the WHO, were founded to guarantee health as a fundamental human right for all. Multilateralism is not just a means to an end. It is the soul of this endeavor, the vessel through which peace, dignity, and health reach every doorstep. The road ahead demands a whole of society commitment for health, which is not merely a goal, but the very foundation of lasting global peace. Amidst the strain on WHO's finances, we must not falter. We, the member states, must rise above fiscal hesitation with unified resolve. As the WHA president, I urge every member state to support the WHO investment round, back the 20% increase in assessed contributions, and provide the organization with the flexibility to act swiftly, wisely, and effectively. Remember this: the cost of inaction and delayed action is measured in lives. We can no longer avert our gaze from the pressing realities of our time. Echoes of conflicts, wars, and rumors of wars, the relentless toll of disasters, and a changing climate, the persistence of diseases, and the ever-present threat of another global pandemic. These are not distant storms on the horizon. They are unfolding before us, shaping the course of our shared future. And in the face of uneven progress and insufficient and unsustainable investment for health, the consequences grow ever more profound, too vast, too consequential for us to ignore. In the spirit of solidarity and as a clear expression of our commitment, the Philippines, through the leadership of our President Ferdinand R. Marcos Jr., manifested during the 2024 Western Pacific Regional Coordinating Mechanism to contribute to the WHO investment round in the next 4 years. I hope that each of you shall do the same. Today, I call for all of us to come together and reinforce the organization through sustainable financing and pledges of support, while working with the Secretariat in diligently recalibrating the organization, the budget, the structure, and greater operational efficiency. Now more than ever, the world needs more hands that heal, health workers who carry the weight of our shared hope. My country, the Philippines, a steadfast wellspring of skilled and compassionate health and care workforce, remains deeply committed to serving humanity by developing and nurturing health professionals. Likewise, we are equally grateful for the global community's resolve in prioritizing the training and retention of health workforce. But the looming global shortfall, an estimated 10 million health workers by 2030, spares no nation. It strains health systems, overwhelms individuals, and frays the minds of those already stretched too thin. No single country can solve this alone. Let the 78th Assembly, through our resolution, building momentum in accelerating actions on the global health and care workforce by 2030, rekindle partnerships among the community of nations that are not just transactional, but transformational, finding win-win solutions that build health and care workforce capacity, honor, dignity, and ensure that no community is left behind. We look forward to revitalizing the central role of the WHO in strengthening capacities, providing technical support, and replicating innovative and positive practices towards ensuring equitable and sustainable development of the health and care workforce. Excellencies and distinguished delegates, this assembly is more than a gathering. It is a declaration that unity, not unilateralism, shall define our response to the world's gravest health challenges. That solidarity, not isolation, shall be our strength. Now more than ever, we summon courage and steadfastness against fear that fosters inaction. We embrace hope and strive for peace, and we may help shape a fairer world. We, the WHO, through our collective will, shall remain the beacon of health for all, emanating hope in a turbulent and fragmented world. As President of the Assembly, I stand beside you, as a bridge builder, a pathfinder, and a believer in our shared humanity. You have my solemn pledge and confidence that together, as one, we can pursue an agenda that fosters hope for health and peace for all. Thank you. We shall now consider item 1.4, adoption of the agenda and allocation of items to the main committee. Let us turn to the proposal for a supplementary agenda, which is found in the document A78/1, revision 1.